Hello, Assalamu alaikum. Can you hear me? That's fine. There are only 8 students. Shall we wait? Okay, we'll wait for 5 minutes. We'll start by 8:05 so that other students can join the lecture. Assalamu alaikum. Good evening, everyone. We'll be starting today's lecture. So today's lecture will be on setting up of periodontic clinic. The basic idea of this lecture is that managing a child in a dental clinic is totally different from that of an adult patient. The reason is because child is most of the time anxious and fearful even of unknown things. Okay, so basically, uh, it basically starts from your clinic, the design of your clinic, how friendly is your clinic to the child. Okay, so that it reduces the anxiety, the fear in the mind of the child and makes him more cooperative on a dental chair. So we'll be discussing in today's lecture about how should be the design of a periodontic clinic and what are the etiquettes you need to manage in a clinic where you are treating children. So this will be discussed in today's lecture. So to begin with, every clinic, okay, if you are designing a dental clinic, a general dental clinic is different from that of a clinic that is exclusively designed for treating pediatric patients. The reason is because the pediatric dental clinic requires a lot of separate spaces that includes play area, waiting area, reception, as well as radiographic room, consulting room, as well as the operatory room. Even in operatory room, you need to have two different operatory rooms, one for the cooperative child and one for the uncooperative child. So there are, the design of the clinic should be different from that of a routine dental setup. The total amount of space that is required should be appropriate and not too spacious or too congested. Okay, you should keep in always in mind that later expansion of the clinic should be kept in mind. Based on that, you have to design the dental setup for a pediatric practice. Apart from that, layout of the clinic is an important. What is this layout? The plan of the clinic, the design of the clinic is an important part when you're planning a clinic exclusively for the treating the child patients. Now, why do you need a periodontic clinic? Why you can do treatment for a child in a routine dental? Why you need exclusively a separate pediatric dental setup or a periodontic clinic? Why do you need this? The reason is because children are not miniature adults. What do you mean by miniature adults? Children are not just like mini adults. Okay, the mindset of the child is totally different from that of an adult. When an adult patient comes to your clinic, you ask him to get the treatment done. He can get the treatment done even in the first visit itself. He can take the anesthesia, but this is not possible in that of a with that of a children, because the child's psychology is different, the child's thinking pattern is different, the child's imagination is different about the things compared to that of an adult. So the development, the neurologic development as well as the psychological development is completely different from that of a adult. So you cannot treat child as just of a adult. For this reason, you have to come to the level of the child's mindset. Okay, how a child thinks, in what way the child will be comfortable. Based on that, you are going to design the clinic. Children basically, they react differently to places. Okay, they react differently to places and people. Hence, the approach of the clinical staff and the clinical atmosphere is very important to make the child very cooperative in a dental setup. Most of the time, what happens is these children have a place memory. This is often referred to as a place memory. That means when they had been to a place, if they had they remember that place very well. Okay, if they had a positive experience, it is advantage. If they have a negative experience, that will be a disadvantage. For example, a child has been to an hospital where she had seen the doctor with a white coat giving her an injection. So this whenever the child sees the individual wearing a white coat or an apron, she will have the recollecting the same experience, same negative experience. Because of that, what happens is the cooperation of the child will be hampered to a great extent. So for this reason, place memory plays a significant role. At the same time, if a child had positive dental experience, like if a child goes to a shopping mall, they play in the games, they have a positive experience, they have fun. So that area gives them a positive, pleasant experience. So basically, this place memory plays a significant role in the cooperation of a patient. So your design of the periodontic clinic should be a way that it should inculcate a positive mindset, a behavior where the child should experience fun. It should be in that way. It should be designed in that way. Dental office should not look like an hospital. In an hospital, if you go, you'll always see that everybody is wearing white apron. Okay, so that white apron, the spirit, or the smell of spirit, or will often be felt. So these things should not be there in a pediatric dental setup. If such things are there, the child can often recollect their past experience, negative experience, and can not be cooperative on the dental chair. So as a result, basically when you are designing a dental setup, pediatric dental setup, it should have a pleasant environment. How it should be, I will explain in the later part of lecture. The pleasant environment reduces the anxiety of the child, reduces the fear of the child, makes the child more comfortable. Okay, he can express what he feels, and he will be cooperative in a dental setup, so that he can receive the dental treatment in a very positive way, and he will be cooperative in further future appointments. So this is the reason we need to have a separate pediatric dental setup. So basically, a basic pediatric periodontic practice requires adequate space provision. It should have different areas. It should have sufficient space. Okay, why you need sufficient space? Because you should have a separate area for reception. You should have a separate waiting area. You should have a play area for the child, waiting area for the parents. Apart from that, factors are also important, like the attire. Attire means the dressing and the behavior of the staff, clinic staff, the color, smells, and sounds of the clinic. Okay, sounds that are produced in the clinic, instructions for the children and parents, uh, audio visual aids, as well as overall a team approach is required to deliver a quality dental care for the children. Okay, it is not only the pediatric dentist or a periodontist is responsible for providing a quality dental care. The quality dental care for a child starts from the reception, so from the staff, from the design of the clinic, from the colors that you choose for the clinic, the environment of the clinic. All these factors have a positive impact on the child's mind, so that they tend to have a positive of mindset coming towards the dentistry and getting the treatment done. Now, how should be a design of a pediatric dental setup or a periodontic clinic? First and foremost thing is that you should have the entry area should begin with a play area. That will be more comfortable, more fun for the child. They'll be very happy to visit the clinic. Okay, later you have a waiting area for the parents as well as for the child. Then you should have a consultation room. Following consultation room, you have the operatory at the end. Okay, basically the operatory should be big. You have two separate operatory rooms. Okay, one with a glass door, so that any uncooperative patient can be treated in the glass room operatory. Okay, the following dental operatory, the child should exit from this area. It is basically an horseshoe shaped design of the dental setup. That is, the child enters from one area and exits from the area. So this, what happens is, even if some child is uncooperative, they will not again enter through the entire whole clinic and leave the same way where they entered. Okay, they will exit from a different exit. So this gives other children more better dental experience compared to that of the uncooperative child. Now, coming to the beginning with the reception. Okay, so how should be a reception? Basically, a receptionist should possess communication skills to deal with children effectively. He or she must call each and every child by his or her name and talk to them about their interests. Often, lack of interest on the part of the clinic staff, that is on the receptionist, to deal with the children fails to generate any excitement in the child. As a result, most of the time, the children are threatened by their parents for a doctor visit. That doctor will give injection. Such things should not be done. Okay, hence before the, if a friendly welcome is done, a cheerful conversation and a playful atmosphere of greeting a child gives the child a positive mindset, and she or he doesn't feel that they are brought for any punishment, so that the job of the pediatric dentist or the clinician becomes more easier. So this should be kept in mind when you're planning a setup. Next is the waiting area. The waiting time of a child in the dental clinic is made pleasant. How you can make it pleasant? By distracting them. How you can distract them? By keeping them in a happy mood whenever they are entering the child, or whenever they are trying to enter the clinic. Okay, so basically the waiting area should have various toys, games for kids. It includes a blackboard, a slide, a soft toy, games, fish tank, anything you can keep, so that it makes the child more comfortable when they are in the dental clinic. They should not feel that they are in a clinic, they are come for to receive a dental treatment. They should feel that they have come for and just for another activity. Okay, so decorations like circus pictures, cartoons, nursery rhymes on the walls should be put up, so that it gives an, it more, you get to the level of the child's mindset, mental level. Okay, and then design the clinic so that the child feels more comfortable and relaxed. His anxiety, he doesn't feel that, oh, I'm going to the hospital, they are going to give me injection. He doesn't have that fear. Okay, he just feels like he has come for some other activity. So it makes the clinician's job very easy. Okay, you can even often play music that is often soothing, and muffled music can be played in the waiting area. Reading material, the parents can need to wait till the turn comes, till the dental treatment is completed. So you can always keep a reading material for the parents that includes various types of magazines. Okay, books for children also can be kept. Some children do like to read books. Okay, you can keep various comic books, story books for children that includes pictures of dental equipment that can make them more understand about what they are going to get it done. Okay, so that you already create a mental picture in their mind, so that they become more cooperative when they enter the dental setup. All this design, all this the activity, all this waiting area, play area, why it is required? The reason is because the child should be more relaxed on the dental chair. The child should be cooperative on the dental chair. Only if the child is cooperative, only if the child is relaxed, you can provide a quality dental treatment. However skilled you are, however very good in your doing the dental treatment, if the child is not cooperative, you cannot deliver a quality dental care. So the first and foremost thing in a pediatric dental practice is making the child cooperative. So how you can make a child cooperative apart from other behavior management techniques? The design of the clinic itself plays a important role in the behavior of the child. The next important, these are some of the pictures of the waiting area in different clinics. It has been shown. Okay, you can have various choice. This makes the child relaxed, more comfortable, and they often, once they have a positive reinforcement, they often tend to visit the dental clinic with more confidence. The next is after waiting area is that the consultation room. In the consultation room, it's the area where the patient, the parent, and the doctor can sit together with minimum interruption. Okay, you can discuss the treatment plan. Okay, you will have an X-ray viewer here. Okay, you have a slide projector, educational computer, as well as other audiovisual aids that are useful. Okay, the doctor's comfortable seating should be present. Apart from that, you can introduce the simple instruments like mouth mirror. You can have a small dental chair where they may sit, so that you prepare the child to receive the dental treatment much before taking them to the operatory room, consultation room. Next important thing is the attire and the presentation of the clinic staff. A child-friendly attire is very essential. What do you mean by child-friendly? You should make an attempt to meet the child casually. Okay, the dentist should meet the child casually, especially not in directly in the operatory, but before operatory in the consulting room. If possible, the consulting room where the dentist first meets the child casually, takes a brief history, assesses their behavior, and then directs the child to dental chair after showing around the clinic and meeting the staff. So this, what it does basically is, if you directly meet the child in the operatory itself, you will be new to the child. The child will not be that cooperative. So try to meet the child in a consulting room so that you talk to him, you know his likes, his dislikes. Based on that, and then take him to the operatory area. So now coming to the operatory area, how it should be the operatory area. Whenever it is possible, it is better to have two dental chairs in the operatory area, placed diagonally. It should not be identically cubed. It can be placed diagonally in the center of the room. The operator and the assistant sit on either chair. Most of the time, no, in the pediatric dental practice, it is not like dentist alone can do all the work. You need four-handed dentistry. Four-handed dentistry means you need an assistant to provide a quality dental care and to finish the treatment in very quickly. The reason is because generally any child patient, okay, any child patient less than 6 years of age does not sit on the dental chair for a longer period of time, unlike adults. If for an adult patient sitting 1 hour in a dental chair, they can manage, but this doesn't happen with the child patient. So you need to finish the treatment quickly. So if you want to need to finish the treatment quickly, you need to have an assistant with you all the time. So 400 dentistry is very much recommended when you are treating the children. When you are coming to level 9 and level 12 in pediatric dental clinics, you will be one of your friend will be assisting you and you will be working. So it will be like a 400 dentistry when you're working on a child to deliver a quality dental care. Apart from that, whenever you're positioning the patient, patient should be placed close to the operator. Okay. If you have a pedo chair, it's not an issue. If you're using an adult chair, try to make sure that, because the adult chair is very big, the child is very small, try to keep the child as close to the operator as possible so that unnecessary movement of the child is avoided, as well as unnecessary posture imbalance for the dentist is avoided to a greater extent. Whenever you are working in the operatory, all equipment should be easily within the reach of the assistant. The assistant should easily pass the instruments and you should keep on working. Make sure that any equipment such as needles, injections, as well as extraction forceps, they should not be kept in a position where the patient can see those things. Okay, it should be kept behind the patient. It should be not kept in front of the patient's eyes. Okay, because this can create unnecessary anxiety for the patient. So any needle, any extraction forceps, any injections, all these things, cartridges, should be kept behind the patient's head. Okay, so that the patient doesn't have any anxiety whenever he sees the needle or a syringe. Okay, simple toys can be used to make the child happy. Often you can use a soft background music also in the operatory area that keeps the child distracted. Okay, and sometimes even the child gets relaxed with the music. Apart from that, the walls in the operatory area, as you see here, the walls in the operatory area, if you have a good painting or a picture that the child likes, okay, generally they like, cartoons or an animal or a dolphin painted on the walls of the clinic, makes the child more relaxed. Okay, a picture of a laughing child is also very good. Okay, so that it sends a positive message to the child. Prevent the child from seeing other children who are crying. This is very important. Whenever you want to do a treatment for a child who is very much anxious, very much apprehensive or uncooperative, it is better to have a separate operatory with a glass barrier, so that even if the child cries, the other child does not hear the sound, so that the cooperation of the other child is not affected. Apart from that, you can have audio visual aids. What are these audio visual aids? These are basically, the audio visual aids play a significant role in managing the children. Okay, basically children forget themselves while watching cartoon films. The TV set in front of the dental chair can distract the child to forget the dental treatment when the treatment is going on. Also, once a child is cooperative, it reduces the need of talking. As they keep on watching the videos, the necessary for talking or the necessary for rinsing the mouth is reduced to a greater extent. So you'll save a lot of time and you complete the treatment in a much earlier way and a quality way. It is a good idea to have a camera. You can see a camera here that is attached to the TV. this camera records the behavior, positive behavior, records the behavior of the child. In case if the child is very cooperative, the next time when he comes, if you play the same video, he will become much more reinforced positively and will try to display the same behavior in future, so that the behavior management aspect has been fulfilled to a greater extent. The next is the color, smells, and sounds in the clinic. Generally, you should, the colors on the walls of the dental clinic should be bright enough, okay? Because the children generally imagine and accept bold, bright, fresh colors such as yellow, red, blue, green. Okay, they like these colors. They do not like colors such as gray, black, and white. Okay, this creates a psychological impact. So it should be a pleasant, bright colors. This gives a positive impact for the child. Generally, you should avoid smells such as spirit or eugenol, because they might have had a negative dental experience earlier that can reinforce the negative behavior in the child. So just try to avoid smells of spirit, eugenol, acrylic in the dental setup. Also try to avoid noises that is coming out from the aerator or suction or compressor. This creates unnecessary anxiety in the child, making them uncooperative for no reason. Apart from that, whenever you're working on the patient, never make sudden movements of the dental chair, suddenly raising the chair, suddenly reclining the chair. This creates, the child feels insecure. Once they feel insecure, they become more uncooperative. So whenever, whatever you want to do, follow the tell show do technique. Tell the patient that you are going to do this, and do it slowly. Make it in a funny way so that they accept it, and so that you can deliver a quality dental care. Then apart from that, instructions for children and parents. Okay, generally, basically you can have a booklet. Okay, you can basically, the notice boards in the waiting room, you can have a notice board in the waiting room which can carry instructions for the parents before dental visits of the children. Or you can have a booklet or a brochure, okay, as a pre-treatment communication that can be mailed to patients well before the appointment. Okay, so that in that appointment letter you can say that don't tell the child about the pain or injection, that don't scare the child that since you did not brush properly, I am taking you to dentist so that he will give injection. If you give this negative experience, or if you scare the child will never be cooperative on the dental setup. Apart from that, a parent might have had a negative dental experience. The parent, mother or father, might have experienced a painful extraction or a painful dental treatment. They try to induce the same fear in the child. Okay, this is not the right way. This instruction should be mentioned in the letter that you are sending to the parent before the appointment, so that they make sure that they inculcate a positive dental behavior in the child. Apart from that, most of the time the parents say that, no, I have come from far place, I want all the treatment to be done, or start the treatment with the first visit itself. This doesn't happen with the child patient, basically. Okay, that's what I told you in the beginning of the lecture. An adult patient, you can do the extraction in the first visit, but that doesn't happen with a child patient. A child patient, you do a painful procedure only in emergency cases. Other than that, if it is not an emergency, you start always with a painless procedure for a child. Very simple procedures like scaling, taking radiograph, then doing pit and fissure sealant, then doing simple restorations, then gradually going for painful procedures. Because by that time, after 3 or 4 visits, the child will be more comfortable in the dental setup. Then you can go for painful procedures like giving anesthesia, doing root canal treatment, or doing extraction. Okay, so all painful procedures should be kept at the end unless and until it is an emergency. So when you are treating children, you should be in a mindset to accept the children as they are. You should be in a mindset to accept the children as they are. Some children are cooperative, some children are fearful, some children are totally uncooperative. Okay, you cannot expect all the children to be cooperative. You have to accept them as they are. If a child is fearful or anxious, after few visits, their anxiety reduces. That is the reason we say start from a painless procedure and gradually go to a procedure that requires anesthesia, or procedure that might cause pain. Okay, always, the communication is very, very, very important when you're dealing with the child patient. Okay, both verbal and non-verbal communication. What is verbal? Verbal communication is what you talk. Non-verbal communication is your gestures, like the movement of the eyes, eye-to-eye contact, holding the child's hand. Okay, these are non-verbal communication. This gives an a security to the child, so that he or she feels that they are in the safe hands to get the treatment done. Language competency. Generally, a child less than 3 years cannot speak fluently. Okay, so they cannot express what they are feeling. So you have to be very patient when you are treating the children less than 3 years of age. Most of the time, they don't understand what you are saying. You have to be very patient. You have to repeat the instructions, and most of the time, these patients appointment should not last more than 20 minutes, because they will not sit for more than 20 minutes. Okay, so if a child is of 3 to 6 years, okay, the separation anxiety is reduced. That is separation from the parents. Okay, they will understand, they will accept. At 3 to 6 years of age, you can use various behavior management techniques like tell show do technique. That is, tell show do means whatever procedure you're going to do. Okay, for example, if you're going to use a mouth mirror, don't directly take a mouth mirror and place it in the child's mouth. Tell them that this is a mirror, in this I am going to see your teeth. That is telling. Then showing the mirror, then placing the mirror in the patient's mouth. This is called as tell show do technique. Okay, by this way, the child's anxiety and the fear is reduced to a greater extent, and tends to be more cooperative with the dentist. Then modeling is also a behavior management technique that will be taken for you as a separate chapter for non-pharmacological behavior management. So the modeling is something like, if two patients, one patient is very cooperative, the other patient is very anxious. You can be a brother or a sister of that patient. You can take the patient who is anxious to the patient who is getting treatment done, see them, talk to them. They say that yes, I'm getting treated well, I don't have any pain. Then they feel that okay, even I can get treated. So this is called as modeling. Voice control is also a behavior management technique, where tell show do fails, where modeling fails, then you can come to voice control. Voice control is nothing but a dentist raises his voice. Okay, sometimes no, the child cries for no reason. Okay, even if you are not doing any procedure, still they keep on crying. In that conditions, if you raise your voice, most of the time they tend to listen to you. Okay, this is called as voice control method of behavior management. So child can cry for various reasons. Apart from pain, if they cry for any other reason, it should not be very much welcomed in the dental setup. Okay, you try to use a voice control method and complete the procedure. If they are crying for pain, then it is a concern that needs to be addressed. If the anesthesia is not working, you have to give a proper anesthesia. Okay, the child cannot differentiate between the pressure and the pain. Okay, unlike adults. Okay, so they might cry for pressure, they might cry for you might have given a very good anesthesia, the block is working, but still the child is crying. It can be because whenever you hold the forceps, you might be feeling the pressure. But once you talk to him, you reassure him, most of the time the children become cooperative. Then apart from that, once the treatment is completed, you can give gifts and rewards for the child. This gives a positive reinforcement for the child. What is this reinforcement? I have done a good job, I got a gift, so I will again do a good job. This is called as positive reinforcement. Okay, so the child was cooperative, you got the treatment done, so you give a gift. So the child feels that okay, next time I will be cooperative, then again I will get a gift. So this is called as a positive reinforcement, a token of appreciation. You can give, you know any toys, but generally, but it's sweets or sugary drinks. Okay, this actually it increases the risk of caries, and it's not that good for oral health. So better to avoid these things, and you can give other toys or anything that makes the child happy. Okay, but never bribe the child. What is bribe? Bribe means you are telling the child that I will give you 5 reals or 10 reals, so be cooperative before the procedure done. Any reward that is given before doing the work, before doing the procedure, that is called as bribe. That should not be done. Okay, so that will create a negative dental impact, negative impact on the patient's child's mind. Never bribe. Gift is something different. Gift is given after the procedure is done. Bribe is given before the procedure. So bribe should never be done for the child. You should always give a gift if the child has been cooperative. This creates a positive behavior, positive reinforcement. Next time when he comes, he tries to display the same positive behavior so that you can deliver a quality dental care. Most of the time, pedo chairs are available. Okay, this has its own advantages and disadvantages. Most of the time, the spittoon is not advised for a pedo chair because the child often tries creates a diversionary tactic that frequently expectorates. Okay, so suctions can be used instead of spittoons. Basically, a team approach is essential if you want to deliver a quality dental care. A team approach is very essential if you want to give the child a quality dental experience. What is this team approach? The whole team should work with a plan for each visit of the child. The plans, however, should have certain flexibility. Okay, so if there is an uncooperative child, you call them at a time where there are not other children very much in the dental clinic. Okay, a separate pediatric session you can keep for general practice. If you are having a general dental setup, for example, you're having a general dental setup, you treat only adult patients, you can keep that every Wednesday and every Saturday we will see pediatric patients. So on that day only pediatric patients you can keep. Weekly 2 days for pediatric patients and the rest of the days, weekly 5 days, remaining 5 days for adult patients. This can divide the attention, and you can also be mentally prepared to treat the pediatric patient. Overall, the team should have a flexible approach and a good communication skill, as well as there should be a child-friendly attitude whenever they are treating the child. Additional features for the dental clinic includes like you should have a first floor location is most often preferred. It should have a horseshoe traffic pattern. I told you in the earlier, entry should be in one area and exit should be from the other door. Okay, they should have a dental health educator, a small dental chair in the conference room. It will be very comfortable for the child. You should have a glass sound barrier, that is especially for an uncooperative child, so that the sound and the noise of uncooperative child does not affect the cooperation of the other child. The dental chair should be narrow and thin back, especially for the pedo chairs. They should have a separate operatory for lengthy procedure. If you're doing a procedure that lasts for more than 40 minutes or 50 minutes, like sedation or pulpectomy or anything, that you can have a separate operatory for that. Okay, so that the routine doesn't get disturbed. That's all about today's lecture. Basically, pediatric dentistry is not difficult, but it is different. Okay, so you have to keep in mind, you have to get to the level of the child thinking pattern, and based on that, you have to design your clinic. Based on that, you have to manage the child in such a way that the child always remains um, cooperative and accepts the dental treatment in a positive way. Okay, so this is all about today's lecture. If you have any doubts, you can post your questions in the chat box. Thank you very much.